Dr. Carter, what do you think about this latest report from Italy and then now on WebMD about COVID-19 being potentially a blood disorder, not necessarily only or always a lung disorder?
Very intriguing, but it would definitely explain why so many people are not doing well on the ventilators and unfortunately expiring. Based on that information, it does seem like what's happening is the virus is binding to the hemoglobin in the red blood cells. But what is happening is it's liberating the iron portion in the hemoglobin that allows oxygen to be carried. And this excess iron that is being liberated causes damage to the lungs, the oxidative stress, and it also causes damage to other body organs as well. But when you don't have the iron that is integrated into the hemoglobin to allow it to carry oxygen, then the blood cells are deficient in oxygen. So obviously we all need oxygen to live and survive. So if that oxygen is being displaced basically by the virus, so to speak, then people are having low oxygen levels by, you can measure that with what's called a pulse oximeter. And they are having very low desaturations of their oxygen carrying capabilities.
Well, it appears from the study from Italy and then the paper in China is not everybody has this lack of oxygen, so blood-related syndrome. They actually do have the acute respiratory distress syndrome. So it's really quite interesting that the one virus or the complex of viruses that make up SARS-CoV-2 could be causing different endpoints. Any comment on that?
Yeah, well, I think, from a genetic level, people are quite different in how they are expressing this disease syndrome. So, and how the body is able to handle it, which is, of course, why it doesn't happen in everyone.
Now, what they're talking about in terms of protocol is determining L versus type H. And the L type is the one with the hypoxia, the lack of oxygen carrying red blood cells. And what they're doing there is not force ventilating. They're just allowing the person to be in a high oxygen partial pressure environment. So like we're breathing 21% oxygen now, they might put them at 100%, but not extra pressure. Whereas the ones that have the stress, the syndromes, the SARS syndrome, need the extra pressure. Is that what you're hearing as well?
Yes, absolutely. Absolutely. So, and that extra pressure is damaging the alveoli. So basically, we really definitely need to look at just the high percentage of oxygen rather than the extra pressure that is placed on the individual with these ventilators.